Good. My name's Erin. I'm with Chamberlain University. I'm a nursing student. I'm going to be taking care of you today. Can I get your name and your date of birth?
Lindsay, age 15, 86.
Okay, great. Lindsay, I'm just going to pull this curtain for privacy here real quick. So what brings you in today?
I need a physical.
Physical? Okay. So I'm going to be performing your exam today. When we do our physical, it's about 10 to 15 minutes, pretty non-invasive. I'm just going to make sure that everything is working really well, make sure you don't have any complaints about anything, okay? So we'll start head all the way down to the toes, okay? Any pain or anything at the moment?
No.
No? Okay. And then any allergies that I should be aware of? Environmental, food, latex, anything like that?
Penicillin.
Penicillin? Okay, and what's the reaction to that?
Body rash.
Body rash, okay. So we'll make sure that we stay far away from that, okay? All right, do you know where you're at today?
Chamberlain.
Chamberlain, okay. And do you know what the date is by chance?
December 2018.
Okay, so patient is alert and orientated times 4, 2-person, place, time, event. All right, so just kind of looking at my patient, her posture is upright. She has proper hygiene. She's dressed appropriately for the weather. Her mood and behavior is appropriate for the situation. She's cooperative, she's calm. I don't see any signs of visible distress, no ambulatory aids. So I'm gonna go ahead and get started, Lindsay. If you have questions at all throughout the procedure, just let me know, okay?
Sure.
So the first thing I'm gonna go ahead and start with is your hair. I'm just gonna kind of feel around, okay? So normal cephalic for the head shape. I'm not seeing any lumps, lesions, no dry skin, and no infestations. All right, so now we're gonna move on to your ears. Lindsay, do you have any environmental things that affect your hearing at work, outside of the home?
Nope.
No, okay, and any hearing aids that you wear?
Nope.
No, how about glasses or contacts?
Contacts.
Contacts, okay. And you wear those all the time?
Yes.
Okay, great. So I'm gonna just kind of shine a light in your ear, make sure that we don't have any drainage, all right? So I'm gonna go ahead and check your ears on this side. Great, no drainage there. All right, and no drainage there. I do see that you have some piercings, no earrings in, but you do have your ears pierced? Okay, great. And there's no pain or any tenderness around there?
Nope.
Okay, awesome. So now I'm gonna go ahead and take a peek at your eyes. I'm just gonna have you look here. I'm gonna shine a light on both sides, okay? As of right now though, pupils are equal and round. Here comes that light, just stare straight ahead. All right, and pupils react to light bilaterally. So now, Lindsay, I'm just gonna have you follow this pen all the way to your nose, okay? All right, and eyes accommodate bilaterally. All right, so I'm gonna go ahead and check out your nose. If you could just tilt your head back just a little bit. All right, no drainage there. Have you had any trauma or deviated septum or anything I should know about? No? Okay, and if I could just have you plug one side and breathe in. Okay, and the opposite side. Great, so nares are patent bilaterally. Nose is midline, no signs of trauma. Can I see smile for me? All right, so face is symmetrical, ears are in proper placement. And I'm gonna go ahead and have you open your mouth. I'm gonna take a peek inside, okay? And can you say ah for me?
Ah.
All right, so mucous membranes are pink and moist. The uvula rises and falls midline. Teeth are intact. No signs of lesions or irritation, okay? All right, so now I'm gonna go ahead and feel your carotid artery here. I'm gonna just place my hand gently on one side. All right, 2+. And 2+. I'm gonna go ahead and take a listen, okay? All right, if you could just hold your breath. Great, no bruising noted in your carotid. I'm gonna go ahead and take all of your vitals. We're gonna get your blood pressure, your heart rate, your respirations, and then your oxygen level, okay?
Sure.
So I would do those right now. And everything is within normal limits. So now I'm gonna go ahead and just kind of work my way down. I'm gonna listen to your lung sounds. For the patient, I'm not seeing any labored breathing, no use of accessory muscles, so that's great. Chest is elliptical, and I'm seeing a 1-to-2 ratio. So I'm gonna go ahead and just listen. I'm gonna place my stethoscope on 6 different locations on the front. Each time I move my stethoscope, if you could just take a nice deep breath in, okay? All right, nice deep breath in. Great. And again. And again. And again. All right, one more. And one more. Great. I'm gonna go ahead and listen to the back side. Same thing, 6 different locations. Once I place my stethoscope on, just take a nice deep breath. Okay. last one. Great. So respirations are clear bilaterally, both anteriorly and posteriorly, with no adventitious sounds. All right, Lindsay, so now I'm gonna kind of work my way down. I am gonna listen to your heart rate, so when we get to that point, I'm just gonna have you lay down. In the meantime, I'm just gonna assess your skin, okay? So I'm not noting any lesions, no scarring. Skin is warm, pink, and dry. We have some pink undertones there. Her skin is appropriate with her ethnicity. So I'm gonna go ahead and check your capillary refill, it's called, on your nails. So I'm just gonna lightly press down, okay? And capillary refill is less than 3 seconds bilaterally. I'm gonna listen to your pulses here on your wrist. These are the radial pulses. And those are 2+ as well. All right, so I'll have you lay back if I could. All right. So I'm gonna go ahead and listen to your heart. It's gonna be under the breast tissue, so I'll just have you lightly lift that, okay? All right. Lindsay, so I got 78 beats per minute. Heart rate is regular, no extra sounds. All right, so I'm gonna go ahead and just lift up your shirt slightly. I'm gonna take a peek at your stomach, okay? All right, so upon inspection, I'm not seeing any lesions, no pulsation present, no scarring, no skin breakdown. The skin is warm, it's homogeneous, and I'm not seeing any lumps or bruising. All right, so I'm gonna go ahead and listen to your bowels. It's just gonna be placing my stethoscope on your stomach here, just a couple different spots, okay? Okay, so we have active bowel sounds in all 4 quadrants. Now, Lindsay, I'm gonna go ahead and just kind of feel around you. Let me know if there's any pain or tenderness, okay? Doing okay? All right, so I'm not seeing any signs of guarding, no rigidity, no facial grimacing, no tenderness reported. All right, so I'm gonna go ahead and pull your shirt back down here. While I'm here and we're have you laying down, I'm just gonna check your pulses on your feet. So I'm gonna remove your shoes and socks. All right. All right, so pedal pulses are 2+ bilaterally, which is great. Go ahead and put these back in the
Yeah,
thing.
I'll just push it up.
Okay.
Yeah. I'll push it a bit.
Perfect. All right, if I could just have you sit up on the side of the bed. All right, and I'm just gonna use your arm here. All right, so skin is elastic, no signs of tenting. So Lindsay, we're gonna check your muscle strength now. I'm gonna go ahead and push and pull against you. You just pull the opposite directions, okay? So put your arms up like this for me. All right, and pull against me, and push, and out to the sides, and into the center, Okay, so muscle strength is 5 on upper extremities bilaterally. I'm gonna go ahead and do the bottoms here. Now if you wanna just push against and pull, in, and back out. All right, so lower extremities are a 5 for strength bilaterally. Lindsay, I'm gonna have you walk from this wall all the way down to the blue line here, if I could, and just kind of watch you. Good. All right, go ahead and have a seat. So her gait is smooth and steady. Can I help you with anything else, Steve? Any questions about anything? Everything looks great so far. Good, okay. If you have any questions, don't hesitate to call. We're always here to answer anything you need, okay?
All right, thank you.
Thank you so much for your time.
Bye.
Have a good one.